Hey everyone, so this is Ces Joan Suficiencia, and I will be talking to you about pertussis, and I will be including the overview, the chain of infection, risk factors, signs and symptoms, complications, the pathophysiology, and diagnosis, management, and the prognosis. So if you want to learn more about this video, please do continue watching and let's get started. So in overview, pertussis is a tract infection characterized by a paroxysmal cough and is highly contagious. And it is also known as the whooping cough, and it was first identified in the 16th century. In 1906, Bordet isolated the most common causative organism, which is the Bordetella pertussis. And it is also called the 100-day cough because it can last for weeks to months. And the causative agent is caused by Bordetella pertussis. And in a microscopic view, you can see a rod-shaped bacteria, and this bacteria attached to the cilia that line of the upper respiratory system. And so the bacteria releases toxins, which damages the cilia and causes the airway to swell. Pertussis remains a significant cause of morbidity and mortality in infants younger than 2 years. So these are the example photos of the Bordetella pertussis under microscopic view, and a child with broken blood vessels in the eyes caused by pertussis cough. So next is the chain of infection of the disease pertussis. So the infectious agent, the pathogen that causes pertussis is the bacteria that is known as Bordetella pertussis, and it has an incubation period for about 7 to 20 days. Next is the reservoir. Pertussis is a human disease, and there are no known animal or insect vectors. And the most common reservoir are adults and adolescents. The portal of exit of pertussis is that the respiratory system, since it causes a chronic cough, which causes the bacteria to be expelled into the air via droplets. The mode of transmission is that it travels through the air inside the water droplets and is expelled from the body of infected people. And this expelled material can also contain blood and sputum. Portal of entry of the disease or the bacteria is that it enters through the body through the respiratory system. When an infected person coughs, sneezes, talks, or even breathes, the bacteria is released into the air. And then the susceptible host of the disease is basically people of all ages are susceptible to the disease who are not vaccinated. Anyone who has not had the vaccine for 5 to 10 years are most likely susceptible again. So infected people are most contagious up to about 2 weeks after the cough begins, and antibiotics may shorten the amount of time when someone is contagious. So while pertussis vaccine are the most effective tool to prevent this disease, no vaccine is 100% effective. And when circulates in the community, there is a chance that a fully vaccinated person of any age can catch this disease, but it's not usually that bad. The risk factor of pertussis includes non-vaccination in children, and infants who are younger than 12 months who are unvaccinated or haven't received the full set of recommended vaccines have the highest risk for severe complications of death. So the whooping cough vaccine you receive as a child eventually wears off, and this leaves most teenagers and adults susceptible to the infection during an outbreak. Anyone that is lack of immunization or impaired immune response to vaccination, contact with an infected person, epidemic exposure, and pregnancy. So the signs and symptoms of pertussis is that the symptoms of pertussis usually develop within 5 to 10 days after the exposure, and sometimes pertussis symptoms do not develop for as long as 3 weeks. So pertussis can cause serious illness in babies, children, teens, and adults. So there are two stages for the signs and symptoms to appear. There is an early symptoms which lasts for 1 to 2 weeks, and they include runny nose, low-grade fever, mild occasional cough, and apnea in babies. And in the later stage, symptoms usually persist after 1 to 2 weeks. And the thick mucus accumulates inside your airways, causing the uncontrollable coughing. So this includes paroxysms of many, followed by a high-pitched whooping sound, vomiting during or coughing fits, and exhaustion. So pertussis in early stages appear to be nothing more than a common cold, and therefore healthcare professionals often do not suspect or diagnose it until more severe symptoms appear. So pertussis is a 12-week disease divided into catarrhal, paroxysmal, and convalescent stages, each lasting for about 1 to 2 weeks. So in the disease progression, starting with the initial exposure to the bacteria. And typically there is a week-long incubation period wherein the bacteria is in the respiratory tract, dividing and causing damage, but there are no clinical symptoms yet. And so the catarrhal starts from the onset of the symptoms to about 2 weeks. It is where the inflammation starts, which gives the clinical manifestations of runny nose, low-grade fever, mild and occasional cough. And symptoms in this stage may be hard to distinguish from a common cold, and unfortunately, it's the stage that pertussis is highly contagious because the bacteria hasn't been killed by the immune system yet, and so it's dividing and multiplying to high numbers. So in the next 2 to 8 weeks, or the paroxysmal stage, the disease isn't as contagious, but the inflammation and damage caused by the bacteria causes extreme coughing fits, where there are whooping sounds could be heard. And clinical manifestations like vomiting, rapid coughs, and exhaustion is due to the forcefulness of the cough. And the convalescent stage is the stage where the body is recovering from the illness for about weeks 8 to 12. And then the body needs to heal from the damage and infection caused by the disease. And the cough will go away eventually, but it takes a really long time for it to be diminished. That's why it's also called the 100-day cough. So next is the complications. Complications of pertussis includes pneumonia, hypoxic encephalopathy, otitis media, tuberculosis activation, epistaxis and hemoptysis, hernia, reinduction of paroxysmal coughing with upper respiratory infections, seizures, cerebral hemorrhage, coma, and death. So the pathophysiology of the disease pertussis is that when Bordetella pertussis produces many biologically active substance, when it is inhaled through the body of the respiratory system, it liberates numbers of toxins and antigens, which causes the pathological changes in the respiratory tract, in the nasopharynx or to the bronchioles. And then there is an inflammation of a respiratory mucosa, which leads to the damage of local epithelium, and then leads to necrosis, and then there is a tenacious micropurulent exudate, which causes the person infected to cough. So the diagnosis of this disease is that diagnosing the whooping cough in its early stages can be difficult because the signs and symptoms resemble those of other common respiratory illnesses, such as cold, the flu, or bronchitis. So there are few diagnostic tests to be done. One is the nose or throat culture. The doctor takes a swab or suction sample from the area where the nose and throat meet, or in the nasopharynx. And then the sample is then checked for evidence of presence of a whooping cough bacteria. Next is the PCR, or the polymerase chain reaction. For this PCR testing, the nasopharyngeal specimens should be taken at 0 to 3 weeks following cough onset. Next is the chest X-ray. So X-ray may be ordered by the physician to check for the presence of inflammation or fluid in the lungs, which can occur when pneumonia complicates whooping cough and other respiratory infections. Next is the management. So the goal of treatment is to limit the number of paroxysms, to observe the severity of cough and provide assistance when necessary, and maximize nutrition, rest, and recovery. So infants are typically hospitalized for treatment because whooping cough is more dangerous for that age group. And treatments for older children and adults can be also managed at home. So in the pharmacologic therapy, the antimicrobial agents and antibiotics can hasten the eradication of the Bordetella pertussis and help prevent the spread of the infection. Another is taking the medications erythromycin, clarithromycin, and azithromycin are preferred agents for the patients aged 1 month or older. So other managements and home remedies includes getting plenty of rest. A cool, quiet, and dark bedroom may help you relax and rest better. Another is drinking plenty of fluids. Water, juice, and soups are good in choices. And in children, especially for signs of dehydration, such as dry lips, crying without tears, and infrequent urination. Next is eating smaller amount of meals. So to avoid vomiting after coughing, eat smaller, more frequent meals rather than large ones. Clean the air. Keep your home free of irritants that can trigger coughing spells, such as tobacco smoke and fumes from fireplaces. And lastly, prevent transmission. So cover your cough and wash your hands often. If you must be around others, wear a mask. So in prevention of the disease, you can have an immunization. So there is a DTaP vaccine, and it is recommended at the age 2, 4, 6, and 15 to 18 months. And at age 4 to 6, it is not recommended for children aged 7 years or older. And a Tdap vaccine recommended for children aged 7 to 10 years who are not fully vaccinated. And as a single dose for adolescents 11 to 18 years of age, for any adults 19 years of age or older, and for pregnant women, regardless of vaccination history, including repeat vaccination in subsequent pregnancies. So the prognosis of the disease is that for full recovery from pertussis is excellent in children over 3 months of age. In those less than 3 months, the mortality rate is 1 to 3%. Complications of pertussis in older infants and children are usually minimal, and most patients make a gradual but full recovery with support care and antibiotics. So the minor complications during the illness include epistaxis, nausea and vomiting, subconjunctival hemorrhages, and ulcers in the frenulum. Patients with certain comorbid conditions, however, have a high risk of morbidity and mortality and should be evaluated on an individual basis. So thank you, and that ends my presentation. I hope you've learned a lot from it, and you can give it a thumbs up, and I'll see you on my next videos.